I think it's very important to work with rather than on communities. And by that I mean we as outside researchers and students don't go in with our own agenda, with what we want to study, but rather we're open to hearing what it is that the community is concerned about and letting that guide the research questions that we develop, and working collaboratively with communities, both on designing and conducting the research, and then, perhaps most important, using the results to help bring about some action, some change. One of my favorite projects that really showed the power of community involved a study we wanted to do looking at the strengths and the problems faced by older African-American grandparents who suddenly found themselves raising grandchildren because of the crack cocaine epidemic. Through partnering with predominantly African-American community-based organizations, my colleague Kathleen Rowe and I and a team of African-American graduate students were able to go into the homes of many, many grandparents who were in this position with questions that were culturally sensitive because members of the community had helped us devise those questions. They'd help us tailor our survey research instruments and our validated scales so that we could still be true to the science and be careful about the rigor and the validity, and yet ask questions and add questions in ways that would let women also talk about the strengths in their lives, talk about issues that they told us were of particular importance. That study led to an action component that went on for several years and included things like creating a regional and a statewide coalition for grandparents raising grandchildren that fought for legislation to help address the fact that so many of the women we interviewed said that they felt like second-class citizens in the way they were treated. We were able to help use the study findings partly to get the word out to doctors about what they were likely seeing and perhaps not recognizing. The fact that women were coming in, older women, suddenly with out-of-control diabetes and hypertension, a string of broken appointments, and it turned out the reason was they typically had just inherited a grandchild or two and couldn't take care of their own needs. And that, to me, is the essence of what my dean, Steve Shortell, likes to call moving from publication to public action, where you use the results of the scientific studies to help make a difference in the world.